The new, more contagious variant of coronavirus has been found in 6 people across Southern California. And according to Governor Newsom, 4 of them are in San Diego. 1 has been hospitalized. The other 2 have been identified in San Bernardino. And Governor Newsom says contact tracing is underway. Now, that same variant has just been detected in New York. Out of 5,000 tests, only 1 test showed that new strain, which was first identified in the UK. Today, an ICU nurse at Kaiser Hospital in LA became one of the first Californians to get her second and final dose of the coronavirus vaccine. She says the second vaccine is giving her a renewed sense of hope, knowing that her body is developing an immunity to better protect herself from COVID. Now, KPIX5 reporter Andria Borba joining us now on California's plan to speed up this vaccine rollout. Andria.
Well, Juliet, if this vaccine rollout feels anything like the early days of this pandemic when trying to get your hands on a COVID-19 test was an impossibility, the governor actually agrees. And it's not just here in California. Nationwide, there was a plan to have 20 million people vaccinated by January 1st. As of right now, that number stands at 4.5 million. So far, the state of California has only distributed 454,000 doses of 1.29 million COVID-19 vaccine doses they have on hand.
We are working aggressively to accelerate our pace.
Dr. George Rutherford of UCSF called the process of distributing the vaccine, not just in California, but the nation, a Herculean task.
You have to have people to show up to get the vaccine, so they have to know when they're supposed to show up and where. You have to have a clinic apparatus set up in order to administer the vaccines and record the fact that people have been vaccinated.
611,000 doses of the Moderna vaccine have shipped but have not arrived in California yet. The head of Operation Warp Speed on CBS's Face the Nation says the onus to distribute should fall on states.
I don't think we are able to identify exactly which long-term care facility or which CVS store should be getting more vaccine or less vaccine. That has to be done with people that have granular knowledge of their population.
Newsom says the state is working to authorize dentists and pharmacy techs to potentially inject doses of the vaccine. Galley says part of the problem comes with the precise handling needed to thaw, specifically the Pfizer vaccine.
The work of the moment is making sure we bring together those vaccinators with the population who, based on our priority groups, are sort of next in line to be offered the vaccine.
Now, again, there are many problems to this one larger problem of getting the vaccine to roll out, to get those needles into arms at this point. We're talking the staffing problems that hospitals are having right now, like with Kaiser in San Jose losing a bunch of staff members to illness with COVID-19. We're talking locations to distribute this. We're talking reaching out to people and telling them it's their turn to get their first or second dose of the vaccine. There's a lot of moving parts that need to happen to make this all happen here in California. And of course, not just here in California, in New York State, actually, the governor is looking to fine hospitals that are not distributing their vaccine doses fast enough. Live in San Francisco, Andria Borba, KPIX5.